you find me and I'm like this, and I'm in my hospital bed, and I can't breathe. What are you going to do for me?
Sit you up.
Sit me up. What else are you going to do for me?
Put your arms
Oxygenate
up.
me. But I'm sitting up, but what else am I doing?
Put your arms up.
You're going to expand my chest. You're going to make it comfortable, anatomically comfortable for me to be upright. Because just the physical act of moving me up creates more space for me to breathe, and I can't breathe. Okay, so that's important. When you go in your patient's room and the patient's collapsed in the bed, no matter what they're there for, you as a nurse are going to sit them up, aren't you? And help get them in a good anatomical position. That's what you're going to do as the nurse. So let's talk about atelectasis. Because by doing that, the very act of helping someone sit up in the bed helps prevent atelectasis. Temperature-wise, is it warm in here?
Yes.
I'm going to turn the temperature down. I'm probably going to shed my sweater. So what is atelectasis? What do we mean by that?
Collapse lung.
Is it a collapsed lung? Is that going to be too loud? When we manage the respiratory function in patients, we're talking about keeping the alveoli open, aren't we? Okay. Atelectasis is a collapse or airless portion of the lung. It's caused by hypoventilation. I'm in the bed, I'm all collapsed, I'm not breathing. Maybe I just had surgery. Obstruction to the airways. I just inhaled a piece of steak and it went down my left bronchi. Okay? Obstruction to the airways. Or compression. I just got hit by the steering wheel. Okay, so atelectasis is a condition when the alveoli are not getting perfused. Okay? It can also be caused by bronchial secretions. Okay? If I have, so some of you who had strep in your lungs had extra secretions, and they were thick, they were hard to clear, and over time those secretions got thicker and thicker, and you blocked a bronchiole or or bronchus, then you can cause atelectasis. Okay? If you can't cough, you've got fractured ribs, and it hurts to cough, and you just don't cough. Impaired cough can cause atelectasis. Any condition that restricts normal lung expansion. I ask you all if you understood chapters 21. We think about lung compliance. What do we mean by compliance? Any kind of compliance. What does that mean? What is compliance?
Doing what you should.
Change. The ability to change. Okay? And when our lungs are not compliant, they don't expand and contract. All right? So when we talk about lung compliance, we're talking about the elasticity of the lung tissue itself, the ability of the lung tissue to expand and contract based upon the body's needs. Okay? Because the goal of the lungs is to get oxygen where? To the body. And what are we all about? Our brains, right? Okay? So when you start thinking about hypoxia, the first part of the body that's going to notice you have hypoxia is the brain, because we're all about our brain, right? Bodies are like this, and they're big, and they go right up like this because we want to get oxygen in our brain. So anything that restricts normal lung expansion on inspiration can cause atelectasis. Post-operative patients are at very high risk. Why? A couple things. Immobility, anesthesia. Okay, we've put a chemical in their lungs, right? We put them to sleep with a little bit of medication in their IVs, and then we take over their breathing and we use the gas to keep them asleep. Okay, and even though we're very good at keeping people asleep, we are mechanically ventilating them, and that causes some irritation. Okay, so the immobility. So the longer we're asleep, do you think we have a greater risk of atelectasis the longer the surgical procedure? Okay, so what keeps people, when we start waking up, what's going to keep us from moving around much?
Pain.
Pain. Post-operative pain. Okay, so those operative patients are at risk for atelectasis because of the immobility, because of ventilation, because of pain. Why do we need surgery? We just go in and have surgery for any reason?
Sometimes.
Sometimes.
Sometimes, I guess sometimes we do.
But as a general rule, when we have surgery, why do we have surgery?
Because we're sick.
Because we have a disease process that we need to handle, okay? Excuse me, if we've had, if we had knee surgery and we hadn't been able to walk around much and we were immobilized because of pain from that. So any reason we need surgery also puts us at risk for atelectasis, right? So here are the symptoms. They are insidious. What do we mean by insidious?
Slow and slow.
We may or may not be able to tell there's something going on, right? Insidious. It's kind of suspicious, right? Insidious sounds insidious, doesn't it? So we don't always know exactly what's going on, but they can include a cough. Kind of a funny cough. Not really a cough that tells you someone's coughing, but just a slight dry cough. And we start increasing sputum. Why do we increase? What's the purpose of sputum in the lungs? To clear out garbage, right? When our mucus cells in our lungs start producing a lot of mucus, it's because they got to clear out the garbage that's there. So we have increased sputum production, and we have a low-grade fever. Yes, Mindy?
I'm sorry, did you say insidious? It just means that they seem like something's wrong.
Insidious means slow. It can be a very slow progression. It creeps up on you. Exactly. It creeps up on you. In the beginning, they're hard to define. You can't exactly put your finger on it. Your nursing judgment says something's not quite right. And often your nursing judgment is that sort of sixth sense that says, that you get with experience. Something's not quite, it's just not all coming together.
Right.
Okay, so you see that with a lot of things, but you see it with atelectasis particularly, and that's why you have these insidious, you have this onset of sudden symptoms. Well, or slow onset. Well, oh gosh, my patient just came back from surgery, or my patient's not moving around in the bed. And you actually can, if you have a patient with a low-grade fever, simply helping them move and use incentive spirometry and get up and expand their lungs can help take care of a low-grade fever a lot of times. So what do we mean by low-grade fever? Less than 100.4, okay? 100.4. If we don't take care of the early signs of atelectasis, that's when we can get respiratory distress, anxiety. And we have symptoms of hypoxia if we have large amounts of lung tissue that are atelectic, okay? We have large amounts that are affected. In your textbook, figure 23.1 has a very good description of atelectasis. Better than I can stand here and talk to you about. It's a good little rubric, or diagram. So let's talk about the nursing management. You already did a little bit of nursing management when you found a collapse in the chair, right? Frequent turning and early mobilization. Anytime anyone's in the hospital, you get them moving as much as their physical condition will allow them to move. And if you are not able to get them out of the bed, you get them positioned in the bed to maximize lung expansion. And you tell them if they're laying there to clench their fists and wiggle their toes as much as they can while they're awake. Early mobilization and keeping clients in the bed as mobile as you can, given whatever their physical condition is extremely important. And